When you arrive at the scene of a cardiac arrest, time is critical. Compressions should start as soon as possible, and any interruption to those compressions, or no flow time, should be kept to an absolute minimum. It is therefore essential that the airway device is easy, rapid, and reliable to insert. iGel is a supraglottic airway with a non-inflatable cuff, gastric channel, and other features that make it an ideal choice for cardiac arrest in comparison to more traditional devices. One area of particular importance is the speed and ease of insertion. Unlike a laryngeal mask, there is no need to deflate an iGel cuff prior to placement or inflate after insertion. This is because the non-inflatable gel-like cuff is specially designed to mirror the anatomy over the laryngeal inlet. One recent independent study has shown iGel to be 50% faster to insert than the other devices tested, including an ET tube, ProSeal, and classic LMA. iGel could also be inserted during chest compressions. Another common concern during CPR is regurgitation and aspiration. To help combat this, iGel incorporates a gastric channel which has three primary functions. Firstly, it provides an early warning of regurgitation, as regurgitant fluid will be seen coming up the gastric channel, allowing appropriate action to be taken. Secondly, a suction tube can be passed down the gastric channel to allow emptying of fluid from the stomach. And thirdly, excess air in the stomach is vented through the gastric channel, reducing the risk of regurgitation. Seal pressure is also important in CPR, as the patient will often require a high airway pressure to enable adequate ventilation. iGel's anatomically shaped cuff accurately positions itself over the laryngeal framework, providing a superior seal to that of a standard laryngeal mask. Stability is important for out-of-hospital CPR, as the patient may be in an awkward position and need to be moved. The iGel's buccal cavity stabilizer aids this in two ways. It naturally adapts its shape to the oropharyngeal curvature of the patient and resists rotation. The iGel O₂ Resus Pack includes a modified iGel with a supplementary oxygen port, a sachet of lubricant, and an airway support strap, all contained within a sterile pack. We will now run through the use of iGel O₂ Resus Pack in a cardiac arrest scenario.
How long have you been here, James?
First, decide on the most appropriate size of iGel O₂ to use. Correct size is normally determined by weight. Open the iGel O₂ Resus Pack, remove the inner tray containing the lubricant and an airway support strap, and place the contents to one side within easy reach. Place a small bolus of lubricant on the base of the inner side of the main shell of the packaging. Touching no lower than the bite block of the iGel O₂, lubricate the back, sides and front of the cuff with a thin layer of lubricant. Ensure any excess is removed. Grasp the lubricated iGel O₂ firmly along the integral bite block. The ideal patient position for insertion is with the head extended and the neck flexed. But if this is not possible or is inappropriate for the patient, then iGel O₂ can be inserted with the head in a neutral orientation. A proficient user can achieve insertion of iGel O₂ in less than 5 seconds. Introduce the leading soft tip into the mouth of the patient in a direction towards the hard palate. It is not necessary to insert fingers into the patient's mouth. Glide the device downwards and backwards along the hard palate with a continuous but gentle push until a definitive resistance is felt. Do not apply excessive force. The tip of the airway should be located into the upper esophageal opening. The cuff should be located against the laryngeal framework. The epiglottis should be held in place by the epiglottic rest. The gastric channel should open into the esophagus, and the incisors should be resting on the integral bite block. The iGel O₂ should now be secured in place with the airway support strap, or taped down from maxilla to maxilla. To use the airway support strap, slide it under the patient's neck and secure it to the iGel O₂ hook ring using the appropriate holes on the strap. Ensure there is sufficient tension to hold the iGel O₂ securely in place, but not excessive tension that may cause trauma to the patient. Some adjustment of the strap may be needed. A resuscitation bag can then be connected to the iGel O₂ and ventilation can begin. If your resuscitation protocol incorporates chest compressions in combination with passive oxygenation, rather than positive pressure ventilation, the supplementary oxygen port provides an easy and effective method for delivering oxygen passively to the lungs. To use the supplementary oxygen port, remove the cap from the oxygen port and connect one end of a standard oxygen tube to the port and the other end to a suitable method of oxygen delivery and set to the oxygen flow shown in the instructions for use. When treatment has finished, turn off the oxygen supply, remove the oxygen tubing from the iGel O₂ and replace the port cap. When iGel O₂ is being used conventionally, it is important that the supplementary oxygen port remains closed. If required, a suction tube can be passed down the gastric channel to empty the stomach contents. To use the suction tube, place a small bolus of lubricant over the proximal end of the gastric channel, insert the suction tube a short way down the gastric channel, and move it up and down to prime before feeding the tube down. Many independent studies have evidenced the easy and rapid insertion, high seal pressures and improved safety offered by iGel. The iGel O₂ Resus Pack. Stay focused on what matters.